If you have a concern about a health practitioner and you're wondering if this is the right place to be, this video is for you. If you're still not sure what to do after watching this, please contact us and we can help you to work out where is the best place to raise your concern. We mainly address issues about individual health practitioners.
For us to be involved, your concern needs to be about the clinical care, treatment or behaviour of a registered health practitioner, or about a health problem that might be affecting the practitioner's safe care of others.
If you have a concern about how a health service runs or its policies, we can direct you to the right place.
AHPRA and the national boards regulate practitioners in 16 health professions.
We only deal with matters involving these health professions.
If your concern is about someone from another profession, there are different organisations that can help you.
The board takes action on very serious matters. It's possible your concern won't meet the threshold for action to be taken.
We use the information that individuals give us as part of their concerns, and we combine that with other information we have about the practitioner to decide whether they can practice safely, such as the way they practice and historical information about them.
So not every bad outcome or result will require action by the board. For example,
if a patient has an operation where there's a known risk of something going wrong, and then it does go wrong, then it's unlikely that we need to take any action.
If a patient asks for a medication or a treatment that they don't need and it isn't provided, it is unlikely we need to take any action.
If several practitioners provided differing but appropriate advice, or if there was a once-off communication or medication issue, or if a practitioner provided care of a reasonable standard, even though it was disappointing for the patient, we would not normally take action.
On the other hand, the board is likely to consider taking action when
a practitioner has been found to be prescribing restricted medications inappropriately or in inappropriate doses.
A practitioner's clinical knowledge or skills are seriously lacking.
They are involved in a sexual or other inappropriate relationship with a patient, or
if we receive lots of complaints about a person, which indicates serious underlying problem with their practice.
These are examples which would usually require the board to intervene to ensure patient safety.
We also handle concerns about misleading advertising or someone pretending to be a registered health practitioner.
If you're concerned that someone may be claiming to be a health practitioner when they're not, come to us.
If you want to report unlawful advertising by a health practitioner, we want to know. An example of this may be claiming in their advertising to have a miracle cure.
We are a national organisation, but there are some differences depending on where you live.
Concerns about health practitioners are treated differently in Queensland and New South Wales. These organisations can help you.
It can help to know what you want to get from raising this concern.
We can and do take action to restrict what a practitioner can do. These actions are not taken lightly.
However, there are some outcomes that people want from their complaint which we can't achieve.
For example, we can't get you a refund, compensation, or have changes made to your health records.
We can't force an apology or an explanation. However, if a practitioner does apologise or explain their actions, we will usually share this with you.
If you're concerned that a practitioner has a health issue, we may want to know.
If you believe a practitioner's health issue could cause harm to you or others when not managed appropriately, let us know. This could be a physical or mental health issue or an addiction problem.
Just having a health condition in itself is not a concern, because many practitioners practice safely and appropriately with ongoing health issues.
Start by speaking to the practitioner or someone at the health service.
We often find that the best and quickest way to achieve the outcome you hope for is for you to address the matter directly with your health practitioner.
All health services should have a patient advocate or a consumer liaison officer or a complaints officer, and you should raise your concerns initially with them.
If you're not satisfied with their explanation or response, and you're looking for an apology or an explanation, or compensation or a refund, you can contact a health complaints organisation in your state or territory.
Your concerns are important. If you decide to notify us, we will consider them and take them seriously. We rely on the public to help ensure that only safe practitioners are practicing in Australia. If you're still not sure what to do after watching this video, please call us or visit our website.